That's a nice peak you got there.
Yeah, that's what they tell me.
In a 1991 comedy, a doctor headed to Los Angeles to start his career, but he detoured in rural South Carolina. Looking for a doctor, the town recruited Doc Hollywood to stick around. In Mississippi, meet a real-life rural doctor who treats patients from cradle to grave.
Are you Doc Hollywood?
I am. I'm taking care of a hospice patient right before I came in here. Tomorrow morning, who knows what I'll do. Tomorrow, I'm going to circumcise a newborn. And this morning, I got called to help resuscitate a baby who wasn't breathing well.
When Catherine Patterson wrote her personal statement for medical school, she told them she wanted to be a real-life version of Michael J. Fox's character. Patterson is one of 7 family doctors in Indianola, Mississippi. If you need a specialist, it requires a lengthy drive.
Having from here to Jackson, which is 88 miles, there's not a single person who does OB between here and there.
Throughout 2021, this TV station will explore the great health divide in our country, inadequate access to health care for millions of Americans. Some of the greatest disparities in the Mississippi Delta and Appalachian regions.
Why should someone in a big city care?
So what I tell people is if you want food on your table, if you want power when you turn on that light switch, if you want a military that's going to be protecting you, you need to be concerned about your rural brothers and sisters.
Data shows diabetes, obesity, heart disease, and cancer hit the Delta and Appalachia hard. The disparities in these regions strike nearly every county in the 17 states. For example, in these regions, 85% of people die before they're 78, which is the average life expectancy of an American.
Access to healthcare services has always been a challenge in our rural communities and continues to be.
But these areas do have success stories that we can all learn from. 8 of the top 10 communities with the steepest decline of drug-related overdose mortalities in the country are in eastern Kentucky. Experts say spreading the message of these programs and stories are vital.
When the predominant narrative is negative about our rural communities, when the perception is that people are unhealthy or they use substances or whatever the challenges may be, that makes people unwilling to invest or afraid to invest, and it causes those problems to get worse.
Mississippi's Doc Hollywood is one of those success stories.
If you wouldn't have had her input, you may not have any babies, right?
No, I would not have not one baby.
Jaquana Haley Williams had to drive an hour to her OBGYN. After 2 miscarriages, she gave up.
And no one could seem to figure out what was the problem. Why was I losing babies?
But she found Dr. Patterson, who discovered a simple procedure early in her pregnancy would save her children.
Everything turned out good. I have 2 healthy babies.
And in Dr. Patterson, Indianola, Mississippi found a provider working to save lives in this rural community, a piece of a solution to bridging our country's great health divide.
Doc Hollywood is not leaving Indianola.
Well, that's very flattering.
A divide that, if left open, leaves communities fractured and Americans living 2 very different realities.
I think it all kind of relates back to the greater good. You know, we're all on this earth. We are all put here to take care of each other.